I'm Jo Greengrass. I'm Essential Standards of Care Quality Improvement Lead for Frimley ICB, and I am the SRO for the Wound Care Project, Lower Limb Project. We started the project with Yateley PCN. Yateley are a 3-practice site PCN with a population of about 29,000. That's in the south of the Frimley patch. We also, as part of the project, wanted to look at the care of patients in nursing homes. So we did a small project as well in the north of the patch in East Berkshire. The motivation for being involved in the project was, for a very long time, we had had a service in the north of our patch for leg ulcer treatment within a clinic setting. And we had different services in the south of our patch. And we wanted to review the services in the south and to ensure that best practice was being carried out in the south of patch as well, following the national wound care guidance. I think for our biggest challenge, particularly around our test site, was around the coding. To be able to electronically get the information that we needed on data, and to also have a template that was able to gather that information. And that's really important for the future of our services around a locally commissioned service, and that would be then for all our services, primary care services in the south of our patch. We've had some really good results from our data. We are there with the coding, and we are just piloting at the end of the project a template that can be used on the GP record. But what we're getting from the data at the moment is there's been a real increase in good outcomes for patients with good healing rates. So I think the real success was the enthusiasm of Yateley as our pilot site, and the real working together as a small group with community services, with the tissue viability service, with services that we already had in the north of our patch, to support the project. So I think that was one of our real successes, was the partnership working. We've also had some real wins with other working around this. So we've now got a referral pathway into our vascular teams, into our acute trust as well. So I think that we have some really good examples of good partnership working. So I think the feedback has been very good from the teams. They've seen a real change in the ways they've been working, and I think it's been really important that they've been able to see the success of the implementation of the guidance. I suppose what we really found out was that the project has offered up lots of opportunities for the future as well. So I think we, for example, have done some training with all our practice nurses across our patch from this project. So we found some gaps in training, which was really helpful. I think it's also led to greater workings together of services, our services from the north and services in the south as well, which has been good. And I think we've been able to, as we go along, we've developed different things that we didn't expect, as we, so we've got more consistent pathways. We've now got a system-wide leaflet. So I think things like that we didn't anticipate when we first started the project. So I think it was really important to have those documents there that we could use, so to show best practice and to give us a framework to work from as well. So I think, for example, some of the flow chart on the to show the what should happen in practice has been really helpful. Some of the education standards as well, and so I think having that helped us to progress the project much quicker than we could have done if we were doing just local pathways all the time. Absolutely. So I think, well, I would say they all are really helpful. I think the care bundle is really helpful. Certainly the flow chart, thinking about that education information as well is really good. So I would say that if someone was looking to implement it, that they look at all the information that is available and then think about how they can adopt that locally. What's next is about spread for us. So we are talking to a number of other PCNs about how we can adopt it in their local area. Also, we have the locally commissioned service that we've been able to use all the learning from our test site to be able to have that locally commissioned service in a position that we will be able to go ahead in the new financial year. But I think as well we've had some learning around the work that we've done in the care homes as well, so we need to evaluate that as well, how we might be able to implement that going forward to support nursing homes with lower limb wounds. I think it's also helped us to think about a system-wide strategy going forward on all wound care, but I think specifically around how we work together with our podiatry colleagues on the foot ulceration and working with our acute trust as well. So I think there's lots of things that we will be doing following the finish of the actual test site project. Yes, I would say learn from other sites. Don't go out and reinvent the wheel. You know, it's important that if you're going to be a primary care site, we would be very happy to talk to you about, particularly around the coding, around the template on the primary care system. I would say that but it's important to engage system-wide as well. So I would always say that instead of working in just one small area, as like what we did, we talk to the whole system. So we have, I think one of the really important bit was the partnership working. And due to that partnership working, I think Yateley have been able to develop a service that is much more innovative than it would have been if we just had concentrated on that one site. So I think that's another tip for that. And I think you need project management support because particularly in primary care, due to being smaller than a bigger organisation, they do need support to develop a service for the future. So I think it's been a real learning journey for us. I think having the health innovation support as well has been really helpful to challenge us and push us a bit as well on some of the things that we've been doing. I think there's also been that link to the other test sites and the learning from that. So I think that's all been very helpful. But I'd also like to say the enthusiasm of the partners that we've been working on has been fantastic. And I think that's really helped to make this a successful project.